1. Idiom. Keeping your head above water. Meaning, to manage a difficult situation, workload, or stress level without being overwhelmed. Example 1. Even though the patient load is heavy tonight, I'm managing to keep my head above water by prioritizing tasks and delegating where I can. Example 2. The hospital is short-staffed and we're all working extra shifts, but we're managing to keep our heads above water and provide quality care to our patients. 2. Idiom. Playing it by ear. Meaning, to make decisions or take actions based on the situation as it unfolds, without a clear plan in advance. Example 1. We don't know how many patients will need to be admitted tonight, so we'll have to play it by ear and assign nurses to each patient as they arrive. Example 2. The patient's condition is unstable, and we're not sure what interventions will be needed, so we'll have to play it by ear and monitor their vital signs closely. 3. Idiom. Walking a fine line. Meaning, to balance competing demands or interest without making a misstep. Example 1. As a nurse, I have to walk a fine line between advocating for my patient's needs and following the hospital's policies and procedures. Example 2. When making decisions about patient care, we have to walk a fine line between providing effective treatment and managing costs. 4. Idiom. Biting off more than you can chew. Meaning, to take on more tasks or responsibilities than you can handle. Example 1. I volunteered to take an extra shift at the hospital, but I think I might have bitten off more than I can chew. I'm already feeling exhausted. Example 2. I wanted to impress my manager by taking on a big project, but now I realize I've bitten off more than I can chew. I need to ask for help to get it done. 5. Idiom. Cutting corners. Meaning, to do something quickly or without following proper procedures, often in an attempt to save time or money. Example 1. We're short-staffed tonight, but we can't cut corners when it comes to patient care. We need to make sure we're following all protocols and providing quality care. Example 2. The hospital is trying to cut costs, but we can't cut corners when it comes to infection control. We need to follow all cleaning and disinfection procedures. 6. Idiom. Going the extra mile. Meaning, to put in extra effort or work beyond what is expected or required. Example 1. The patient was feeling anxious, so I went the extra mile to make sure they felt comfortable and informed about their treatment plan. I explained everything in detail and stayed with them until they felt calm. Example 2. The hospital is short-staffed, but the nurses are going the extra mile to make sure each patient receives the care they need. They're working overtime and going above and beyond to provide compassionate care. 7. Idiom. Bedside manner. Meaning, refers to a healthcare provider's ability to interact with patients in a caring and empathic manner. Example 1. We received positive feedback from the patient's family about the nurse's excellent bedside manner during their stay in the hospital. Example 2. The doctor needs to work on improving his bedside manner as he comes across as cold and detached with his patients. 8. Idiom. Break a leg. Meaning, a way to wish someone good luck, especially before a performance or event. Example 1. Break a leg on your presentation today. Example 2. I'm about to go on stage for my solo. Wish me luck. Break a leg. 9. Idiom. Crash course. Meaning. Refers to an intensive and brief training program designed to quickly teach a specific skill or knowledge. Example 1. The new nurse had to complete a crash course in electronic health record systems before they could start working on the hospital's computerized charting system. Example 2. The nursing team took a crash course in disaster preparedness in order to respond to emergencies more effectively. 10. Idiom. Drop the ball. Meaning. Means to fail to complete a task or responsibility. Example 1. The nurse apologized for dropping the ball and not following up on the patient's concerns about their medication regimen. Example 2. The doctor realized that they had dropped the ball by failing to order a necessary test for the patient's condition. 11. Idiom. In the dark. Meaning. Refers to being uninformed or unaware of something. Example 1. The nurse felt like they were in the dark about the patient's medical history, since they did not have access to their complete medical record. Example 2. The doctor was in the dark about the patient's condition until they received the results of the diagnostic test. 12. Idiom. Jump through hoops. Meaning. Refers to having to go through a difficult or complicated process to achieve a goal or complete a task. Example 1. The nurse had to jump through hoops to obtain the patient's insurance approval for their medical procedure. Example 2. The nursing student had to jump through hoops to complete the requirements for their clinical placement, including obtaining immunizations and passing background checks. 13. Idiom. The devil is in the details. Meaning. Means that small details or factors can cause significant problems or difficulties. Example 1. The nurse knew that the devil was in the details when it came to administering the patient's medications, as even small errors could have serious consequences. Example 2. The doctor realized that the devil was in the details when reviewing the patient's lab results, as they revealed an unexpected complication that required immediate intervention. 14. Idiom. Throw in the towel. Meaning. To give up or quit a task or challenge. Example 1. The nurse had been trying to help the patient quit smoking, but after several failed attempts, she decided to throw in the towel and refer the patient to a smoking cessation program. Example 2. The nurse had been advocating for a change in hospital policy, but after repeated rejections, she decided to throw in the towel and focus on other priorities. 15. Idiom. Break the ice. Meaning. To initiate conversation or interaction in a social or professional setting. Example 1. The nurse tried to break the ice with the new patient by asking about their hobbies and interests. Example 2. The nursing team had a team-building exercise to break the ice and get to know each other better. 16. Idiom. Cross the line. Meaning. To behave inappropriately or unprofessionally. Example 1. The nurse crossed the line when she made a disrespectful comment to a patient about their weight. Example 2. The nursing student crossed the line when she accessed a patient's medical record without authorization. 17. Idiom. Keep your eyes peeled. Meaning: to be alert and attentive, often in search of something specific. Example 1. The nurse kept her eyes peeled for signs of infection, monitoring the patient's vital signs and assessing their wounds regularly. Example 2. The nursing assistant kept her eyes peeled for the patient's belongings, which had gone missing from their hospital room. 18. Idiom. Pull the plug. Meaning: to disconnect life support or stop treatment on a patient who is terminally ill or brain dead. Example 1. The family decided to pull the plug on their loved one, who had been in a coma for months, with no chance of recovery. Example 2. The doctor suggested pulling the plug on the patient who was in a persistent vegetative state. 19. Idiom. Flatline. Meaning: to have no pulse or heartbeat, often used to describe a patient who has died. Example 1. The patient flatlined on the operating table, and the medical team was unable to revive them. Example 2. The nurse checked the patient's vital signs and realized they had flatlined. 20. Idiom. In the red. Meaning: to be in debt or financial trouble. Example 1. The hospital was in the red and struggling to keep up with the cost of patient care. Example 2. The patient's family was worried about the medical bills and feared they would be in the red if they couldn't find a way to pay them. 21. Idiom. Catch one's breath. Meaning: to take a short break to rest and regain one's composure. Example 1. After running to the hospital from the parking lot, the visitor had to catch their breath before visiting their friend in the ICU. Example 2. The nurse took a moment to catch her breath and clear her mind before starting the next round of patient assessments. 22. Idiom. Bounce back. Meaning: to recover quickly from an illness or setback. Example 1. The patient bounced back from a severe case of pneumonia and was able to go home within a week. Example 2. The athlete bounced back from an injury and was able to return to competition sooner than expected. 23. Idiom. Keep one's chin up. Meaning: to stay optimistic in the face of adversity. Example 1. Even though the patient received a difficult diagnosis, I encourage them to keep their chin up and focus on their treatment plan. Example 2. As a nurse, it's important to keep our chins up and stay positive, even on the toughest days. 24. Idiom. Take a turn for the worse. Meaning: to suddenly get worse. Example 1. The patient's condition took a turn for the worse, and they had to be transferred to the ICU. Example 2. We were hopeful for a full recovery, but the patient's condition took a turn for the worse, and they unfortunately passed away. 25. Idiom. Under the weather. Meaning: feeling sick or unwell. Example 1. I'm sorry, I won't be able to come into work today. I'm feeling a bit under the weather. Example 2. The patient was under the weather and complained of nausea and fatigue. 26. Idiom. Hit the ground running. Meaning, to start working or performing well immediately. Example 1. The new nurse hit the ground running and quickly adapted to the fast-paced environment of the emergency room. Example 2. We had a busy shift, but our team hit the ground running and were able to provide excellent care to all our patients. 27. Idiom. Walk on eggshells. Meaning, to be very cautious or sensitive in one's words or actions. Example 1. The patient was very emotional, and we had to walk on eggshells when discussing their treatment options. Example 2. When working with a difficult coworker, it's important to walk on eggshells and avoid any confrontations. 28. Idiom. Catch someone's eye. Meaning, to draw someone's attention or interest. Example 1. The patient's artwork caught my eye, and we had a great conversation about their creative hobbies. Example 2. As a nurse, it's important to catch your patient's eye and make them feel heard and understood. 29. Idiom. Cover one's tracks. Meaning, to conceal or hide one's actions or mistakes. Example 1. The nurse realized that they made a mistake and tried to cover their tracks, but it was quickly discovered during a chart review. Example 2. It's important to always be honest and transparent in healthcare, rather than trying to cover your tracks. 30. Idiom. In the same boat. Meaning, in a similar situation or predicament. Example 1. As healthcare workers, we're all in the same boat and dealing with the same challenges during this pandemic. Example 2. The patient's family members were also caregivers, so they understood what we were going through, and we were in the same boat. 31. Idiom. Keep calm and carry on. Meaning, it's important to remain composed and focused in stressful situations. Example 1. When the patient's condition suddenly deteriorated, the nurse kept calm and carried on with administering life-saving treatment. Example 2. Despite the chaos in the emergency room, the experienced nurse knew how to keep calm and carry on with her duties. 32. Idiom. Better safe than sorry. Meaning, it's better to be cautious and take extra measures to ensure safety. Example 1. The nurse always double-checked medication dosages before administering them to patients, knowing that it's better to be safe than sorry. Example 2. By donning personal protective equipment during the COVID-19 pandemic, the nurse knew that she was taking the necessary precautions to keep herself and her patients safe. 33. Idiom. On the ball. Meaning, to be alert, attentive, and ready to act. Example 1. The nurse was really on the ball and noticed the patient's deteriorating condition before anyone else. Example 2. In order to provide high-quality patient care, nurses need to be on the ball and stay up to date on the latest medical advancements. 34. Idiom. A bitter pill to swallow. Meaning, something difficult or unpleasant to accept or deal with. Example 1. It was a bitter pill to swallow when we had to tell the patient that their cancer had returned. Example 2. Sometimes giving bad news to patients or their families can be a bitter pill to swallow for nurses. 35. Idiom. In hot water. Meaning, to be in trouble or facing a difficult situation. Example 1. The nurse was in hot water with her manager after she failed to follow hospital protocol for patient documentation. Example 2. Nurses can find themselves in hot water if they don't adhere to ethical standards or professional guidelines. 36. Idiom. By the book. Meaning, following rules and procedures exactly as they are written. Example 1. We have to do this procedure by the book to ensure patient safety. Example 2. The hospital policy states that we have to document everything by the book. 37. Run interference. Meaning, to intervene or take action to prevent problems or obstacles from affecting someone or something else. Example 1. The charge nurse ran interference when the patient's family became upset, taking the time to listen to their concerns and explaining the care plan to them. Example 2. The nurse ran interference with the physician when the patient's condition changed, advocating for a quick response and communicating with the rest of the healthcare team. 38. Idiom. Head over heels. Meaning, to be deeply in love or infatuated with someone. Example 1. She's head over heels for the new doctor on the unit. Example 2. The patient was head over heels with gratitude for the care they received. 39. Idiom. In a nutshell. Meaning, to summarize something briefly. Example 1. In a nutshell, the patient's condition has improved. Example 2. Can you give me the report in a nutshell? 40. Idiom. On the same page. Meaning, to have a shared understanding or agreement about something. Example 1. Let's make sure we're all on the same page before we proceed with the treatment plan. Example 2. The team was on the same page about the discharge plan. 41. Idiom. Keep a straight face. Meaning, to maintain a serious expression, often when faced with something humorous. Example 1. It's important to keep a straight face when delivering difficult news to patients and their families. Example 2. During the silly skit at the nursing conference, I had to work hard to keep a straight face. 42. Idiom. Clear the air. Meaning, to resolve a misunderstanding or conflict. Example 1. I had to clear the air with my coworker after we had a disagreement about a patient's care plan. Example 2. Clearing the air between team members is important for maintaining a positive work Break the news. Meaning: to inform someone of bad or difficult news. Example 1. I'm dreading have to break the news to the patient's family. Example 2. I'm glad it's not my job to break the news to the boss about the project's delays.